Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have real power, real control, and so that you can influence decision making even if you're not a doctor or a nurse in intensive care. In last week's blog, I've shown you the 5-step contrarian advice for families of critically ill patients in intensive care that gives you control, power and influence whilst your loved one is critically ill in intensive care. You can read, watch or listen to the blog by clicking on the link below this video. In this week's blog, I want to show you the 3 things you didn't know that are happening behind the scenes whilst your loved one is critically ill in intensive care, but you must know if you want to have control, power and influence. If your loved one has been admitted to intensive care for critical illness, chances are that you are out of your comfort zone and that you feel challenged, frustrated, vulnerable, stressed, and you feel like there's just too much happening all at once. Moreover, you feel like you have little or no control, power and influence because the intensive care team holds all the perceived power in the situation, and they most likely have already told you so directly or indirectly. What's even worse, they won't tell you what's really happening because the situation that you, your family and your critically ill loved one are in is a very difficult situation, and the intensive care team really has no desire to change that situation. And if anything, the intensive care team wants to make sure that they keep you at arm's length, so to speak, so that they can continue driving their agenda without you, and especially without you and your family having control, power and influence. The intensive care team will also make sure that you and your family don't get any insights into the things that are happening behind the scenes in intensive care. That is driving the decision making, that is driving the allocation of resources, that is driving the positioning of the intensive care team as it relates to your critically ill loved one's prognosis and diagnosis. After all, there's far too much at stake for the intensive care team and the hospital that goes on way beyond the emotional drama that you, your family and your critically ill loved one are going through. Moreover, if you are like 99% of families of critically ill patients in intensive care, the intensive care team continues to hold all the power, control and influence in the situation because you haven't even thought about or considered that the decisions that are made and the positioning that the intensive care team displays is all dependent on the things that are happening in the background and behind the scenes, so to speak. Those dynamics are in play from the minute you enter the intensive care unit, and if you buy into and if you don't question those dynamics, you wind up having no control, no power and no influence at all. Unless you belong in the 1% bracket of families of critically ill patients in intensive care who wind up having control, power and influence irrespective of the situation that they and their critically ill loved one are in. And you may wonder why they have control, power and influence. I'm glad you've asked. Those families have control, power and influence because they question the authority they are dealing with, and they are courageous enough to do their own independent research like you can do here at IntensiveCareHotline.com, and they are not afraid to speak up, ask difficult questions and generally do the total opposite of what 99% of families of critically ill patients are doing. I therefore want to give you the 3 things you didn't know that are happening behind the scenes whilst your loved one is critically ill in intensive care, but you must know if you want to have control, power and influence. Number 1. The intensive care team's positioning of your critically ill loved one's prognosis and diagnosis is always dependent on whether your critically ill loved one is viewed as a good business case or as a bad business case. Therefore, if the intensive care team thinks that they are not making any money if they continue treating your loved one's critical illness, they will position your loved one's prognosis and diagnosis accordingly. This is especially important for you and for your family if your critically ill loved one is facing a long-term stay in intensive care or has any other type of injury or disease, such as severe head injuries or multi-trauma, etc. This is irrespective of whether your critically ill loved one is on a government scheme or a privately insured patient. Your job is to listen carefully and to question the intensive care team's very positioning. Number 2. Many intensive care units are heavily involved in research activities, and generally speaking, a lot of money and funding goes towards research activities. Therefore, if your critically ill loved one falls into one of the research categories, your critically ill loved one may get preferred treatment, at least for a while. However, the outcome may still be uncertain. If, on the other hand, your critically ill loved one doesn't fall in a research category, the intensive care team may not be interested in giving your critically ill loved one their fullest attention. Again, this is particularly important for you and for your family to know if your critically ill loved one is in a difficult situation where the intensive care team is uncertain about the outcome. Therefore, if your critically ill loved one doesn't fall into a research category that the intensive care team might be interested in, your critically ill loved one's prognosis and diagnosis may be positioned by the intensive care team that makes it easier for them to either withdraw treatment or limit treatment, so that they can allocate resources towards other patients where the intensive care team has a higher interest in. Number 3. Generally speaking, intensive care beds are precious and scarce. They are expensive, and they also need a fair number of staff to run, doctors and nurses. Many intensive care units have a good idea of how many admissions are to be expected over the next few days, and they always predict and keep lists of admissions updated. Therefore, if your critically ill loved one is perceived by the intensive care team as a difficult case and one with an uncertain outcome, and therefore could potentially block a bed that would stop other scheduled admissions from coming to the intensive care unit, again, the intensive care team might position your critically ill loved one's prognosis and diagnosis in a more negative light, and the intensive care team may distort the clinical facts and the clinical realities. This again is particularly important for you to know if your loved one might need an ICU bed for a long time to come, or if your critically ill loved one is in a life-threatening and serious condition. In those situations where the intensive care team knows that there are many admissions competing for a limited number of beds, they may give preference to patients who are expected to be less sick and have a higher chance to survive compared to patients who are in difficult, life-threatening situations with an uncertain outcome. It's a lot easier to then tell families of critically ill patients that their loved one isn't going to survive their stay in intensive care, and the intensive care team therefore may suggest to either withdraw treatment or limit treatment and let your loved one die, whereas in reality, if the intensive care team would continue treating your critically ill loved one, they may well get the results that your critically ill loved one and you desire by saving their life. However, the intensive care team wants to give preference to other patients where they don't expect as many difficulties, where they may earn more money, and they therefore tell you and your family that your loved one's situation is quote-unquote hopeless, and the best solution for the intensive care team and their agenda is to let your critically ill loved one die. So how can you leverage your level of power, influence and control whilst your loved one is critically ill in intensive care? And how can you be in control of the situation? You will get to that all-important feeling of power, control and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you instant, in-depth insight that you must know whilst your loved one is critically ill or is dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language, so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free reports, you'll also discover how to ask the doctors and the nurses the right questions, how to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 killer tips and strategies helping you to get on the right path to control, power and influence in your situation. You'll get crucial behind the scenes insight so that you know and understand what's really happening in intensive care, and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section, where we answer your questions, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.